Coming up today, a new option for people waiting for a new liver. Patients waited for a donor and possibly flew out of state to make that happen before. Now there's another option closer to home. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. At any given time, there are upwards of 17,000 patients on the liver transplant wait list, growing sicker by the day. While most wait for a deceased liver, many are going in search of a living donor, a person alive and well willing to give the gift of life. Here's Angie Ricono with a story involving one man's altruistic decision that set off a chain of donations.
You never know what will change the course of your life. For Jeff Reisinger, it was a Google search and then a pop-up ad.
And this little pop-up ad kept coming up on the bottom of the computer screen that said, consider being a living liver donor.
He didn't click the first time, but he eventually did.
Hey, what is this? How does it really work?
Jeff learned livers regenerate or grow back. A healthy person can donate and save someone else. It's called a living liver donation. The Hulls had never heard about it either until Jeff got gravely ill and his son Josh stepped forward.
He said, you don't need to look for a donor for my dad because I'll be the donor.
But their blood types didn't match. Jeff Reisinger, a complete stranger who saw a pop-up ad, offered to be the donor.
The miracle of being able to help someone. And it felt compelling to me.
Josh donated to another stranger in need.
He said, Dad, we're going to save two people's lives.
The chain of transplants took place at the University of Pittsburgh Medical Center back in January of 2023. Father and son walked the halls post-surgery and eventually figured out their mystery donor. Josh stopped by one night.
And he came over near my bed and he just said, why? And he didn't understand. I mean, he knew why he would donate to his dad, but he just asked why.
For Jeff, the answer was simple. More than a year later, he explains how his life pretty much stayed the same, but also changed.
I feel great. I feel great. And just, physically I feel great, but the emotional aspect of the experience is just unlike. It's the most significant thing I feel like I've done in my life, is to be a part of this process.
Jeff Hull's life completely changed too. He's back to hunting and living a full life with grandkids.
I feel wonderful. I just got back from a 10-mile bike ride. I left weights, did bands this morning, and went out hunted. Yeah, it's like another life. God gave him a miracle.
Jeff Reisinger now works at the University of Kansas Health System.
As soon as I got home, this is where I put it, and it's been there ever since.
He showed us a keychain he keeps on his backpack, given to him by Jeff Hull's wife.
This is the day you gave me my husband back.
Oh, wow.
It was. It was cool.
Gosh.
I see that on my backpack every day.
And we are so glad to welcome Jeff and his wife, Susan Hull, joining us all the way from Pennsylvania this morning in their home. Good morning to both of you.
Good morning.
Well, I say both of you. Who's the joiner?
This is Maxine. This is our youngest granddaughter.
All right. We're glad to have Maxine joining us this morning. Jeff, I watched you watching your story. What was that like, seeing your story there for all of us to see?
It brings back memories, real good memories, special memories. I'd like to say this. We look at Jeff as a gift from God to me and my family.
Well, we're so glad you're doing well, and we want to introduce everyone to Jeff Reisinger, who is here with us in our studio. Jeff is part of our leadership team here at the University of Kansas Health System. He is the one who donated to Jeff in Pennsylvania. Jeff, how are you?
I'm doing great. It's great to be here.
So glad to have you and to watch your story. What's it like to just see Jeff and Susan and Maxine and knowing that you did all this?
It's wonderful. I didn't know I was going to get to see them today, and so it's quite a surprise. And I've seen a still photo of Maxine. It's nice to see her moving around, and Yeah, it's really special just to be a small part of that story.
Because this just happened, a small part of this story. You are a very, very large part of this story. And you saw them, what? This happened a couple of years ago, and you just saw them a couple weeks after the surgery, right?
Yeah, it'll be 2 years in January.
So it's been a minute.
We've talked and stayed connected, but I haven't seen them in a while.
Oh, glad to have you all together today. As we mentioned, their surgeries took place out of state, but the reason that we are here talking today is to let everyone know that we now do that here at the health system. The Center for Transplantation at the University of Kansas Health System now has a new living liver program. So we want to bring in our panel of experts to talk all about it. Dr. Sean Coomer is the Chief Medical Officer of the Kansas City Division. He is also a transplant surgeon, sits front and center today. How are you?
Great, thanks for having me.
Good to see you. We also have next to me is the Director of Transplantation, Dr. Tim Schmidt. Hi.
Thanks for having us.
And Dr. Ryan Taylor. He is a transplant hepatologist and the medical director of liver transplantation. Hi, Dr. Taylor, how are you?
Doing great. Good morning.
Good morning. Okay, so let's start with some numbers first, just to put this all into context. Right now, we have 123 people waiting for a liver donation here at the health system. But if you take a look at the number of deceased liver surgeries that we have been performing, you can see that here on the screen. Dr. Taylor, let's start with you. What do the numbers mean?
So the numbers show us that there's still a great need of patients that need liver transplant here and within our area. And so there have been some changes on the national level that have changed how organs are shared, and that has impacted how patients here in the Kansas City metro area have been able to access transplant.
So how long are people typically waiting for a deceased liver?
That's a great question. So what's really interesting about liver transplant is that patients can get on the list and get transplanted quickly. There's not a time element or a benefit given for time for transplant. It's really the sickest patient first. But many of our patients have these disease for years, and it's a very long process to eventually get sick enough to need the transplant.
Well, we've talked about that. I want you to explain the MELD score, because you
Yes.
have to hover somewhere between being healthy enough to get the transplant, but also sick enough to need one and to qualify.
That's right.
Explain the MELD score.
So the MELD score is a calculation that takes 5 very common lab values that we get. We put into a calculator and puts out one number, and that number then can tell us how sick the patient is. That's associated with the risk of dying. And so we use that one number to really encompass how sick that patient is and use for rank ordering on the transplant list.
So Dr. Schmidt, I'm going to let you do the honors and tell us about the new program, how it came about, what it takes to get a program like that here, and what the impact is for patients.
Like Ryan said, the allocation had changed 4 years ago, and the number of patients we could transplant decreased. And so we have done multiple things to try to help our numbers. One, start this living donor program, which takes time because you have to train people. As you could understand, it's a proprietary knowledge. Not a lot of U.S. centers are training people, so you have to almost do training outside of the country. And we did that with one of our younger faculty who spent some time in another country where they do a ton of living donors, and so that's how we gained the knowledge. Sean and I did it back in UVA, but we had done it so long ago we needed to have a refresher course, and now the technology is so much better. And so now we've got the training, the staff was taught around it, how to evaluate the donor is so much different. And so it took time to just develop that program, and I think it will develop here shortly into a bigger program.
As we continue to educate potential donors like Jeff, right?
Yeah,
Because
I mean,
that's a big part of it.
Just like kidney donation, before it was one person to one recipient. Now there's people who just say, I just want to do something to help somebody. And with liver, it's more unique, but it's now happening where people can feel that they want to do that, and it really helps a whole chain kick off. Because if I had to donate to Sean and I wasn't the right blood type, well, maybe somebody else is, and then it kicks off a whole chain of people who get transplanted.
Saving lots of lives.
Yeah, I mean, it's just one person helping another, and it's awesome how it can happen.
I want to talk more about the liver allocation and how it's impacted. This has been a national issue that we've all been talking about for several years, and then you added that pandemic on top of all of it. Talk about how that has been an impact and kind of where we stand today from maybe where we were 5 years ago.
Well, it's just population-based. The bigger cities have more people on the list, and obviously they have more draw for these bigger circles now. Liver is allocated at a 500-mile concentric circle, so a lot of our donors now go to Chicago, Dallas, Houston, St. Louis, and the bigger cities have more people on their list, and so that impacted our number. And I think all the patients are now sick. It's like we have to have a MELD score of 30 to 32 or even higher sometimes to get a transplant, which means you have to wait a long time.
Dr. Taylor, what's that like, though, to be able to share this news with patients, to say, you know, we don't have to send you out of state to do that. You can do that here. You can recover here where your support system is.
It makes all the difference in the world, because the way to get through a transplant successfully is to have that help, have those people around you to support you as you go through this difficult process. And so to be able to offer that here for our patients in this region is just amazing.
Dr. Kumar, who makes a good candidate for a living donor?
Well, it takes someone that's willing. It takes a hero like Jeff to do that first, right, and willing to step up. But really, you know, living donation violates one of the first tenets in medicine is first do no harm. We're doing harm. We're putting somebody at risk that I always tell people for a living donation kidney, the only person here at KU getting an operation you don't need. So that ups the ante. They're not going to get better after this, and God forbid, don't want to make them worse. So really, that's the first thing. You need a hero, and you need somebody to stand up. And then you have to go through a process where you have to go through and make sure you have a good liver, right? You got to make sure there's nothing else that's comorbidity or anything that puts that donor at undue harm. And then beyond that, then it talks about anatomy. So when you're looking at the anatomy, you know, you saw in that cartoon earlier that you have to split the liver, the right side or the left side, or a portion of the left, et cetera, the different methods to do that. But there has to be the proper anatomy, and it sort of has to be almost textbook, because there's a lot of variability in liver anatomy, and if it's not going to be able to, it's fancy plumbing. It's got to fit back together again.
More complicated than kidney?
Well, yeah, I would say absolutely.
So how do you live with a portion, just a portion? You have 2 kidneys. You don't. You only need 1. You only have 1 liver. So how do you live with just a portion of the liver?
Yeah, so you have to leave enough liver for somebody to live on, number one. And the liver will regenerate. It's an amazing organ. You know, within 4 to 6 weeks, it regenerates to about 90% of its original size. But you have to have that original remnant for that person to live on. So that's really what it comes down to.
So Jeff, I want to bring you back in here, our donor. So I can understand, and I think a lot of people understand, you know, giving to a family member, but a complete stranger. How did your family react when you said, you know, I'm going to do this?
Yeah, my wife was very supportive. She worries enough for both of us, so she took care of the worrying part of it. And I just focused on, you know, being in the best health that I could be in and getting through the process. Had great support from her.
What was your recovery like?
It was not too difficult. There was, you know, one of the things I told the surgeon in a follow-up visit several months afterwards is that right afterwards you get some really good naps in. They told me when I left the hospital, they said to your body, your liver's like an infant. It's regrowing just like an infant, and that takes a lot of energy. And so you rest well, and I miss those naps. Those naps are really good.
Right?
Close your office door, take a nap.
Nice, nice. Well, we're just glad you're doing well. Let's turn to our other Jeff, our recipient. I know you guys have exchanged, Jeff, some really cool items since this all happened. Tell me about the football.
Both my sons played for Penn State. My oldest boy actually got to go and play the next level, and they decided that it'd be a nice gesture maybe to give Jeff a ball since he's an Ohio State fan. And they signed it and sent it off to him, and it meant a lot to me what they wrote on.
What about the walking stick?
Yeah, it's a hobby of mine. Yeah, there it is. I make maybe 10 or 15 a year. I find them in the woods. They're one of a kind. They cannot be replicated. I love working with my hands. It's a good winter project for an old retired guy like me.
That's fantastic. Susan, I know you're over there rocking Maxine, which is, again, kind of the cool part of all this is that your husband's able to be there and be there with family. What's it been like for you to watch all this come together?
It's something that we talk about it every chance we get. It's something so special. And we feel like we've been given such a gift because of Jeff. But like you said, our Jeff has the opportunity now to watch our grandchildren grow up. And it just, watching this today, looking at Jeff's pictures that he sent in and the pictures that we shared, it really hits home. You know, sometimes it feels like it's been 10 years ago, and other times I can picture sitting in the waiting room when Jeff was in surgery and Josh sat in there with me. Josh's surgery was the following day, and him and I sitting there trying to figure out which family was with the donor. And I have to say, Josh picked D. He said, that's the wife. And I had picked another family, and they gave us time frames of when the donor would be done and when Jeff would actually go in to receive the organ. And when they came out and got D, Josh looked up at the clock and he said, Mom, that's her. And I said, how do you know? And he said, because look at the clock. He said, it's almost exactly the time frame they told us it would be when it was going to be Dad's turn. And he was right. We got to meet Dee also. So that was incredible. And part of that, it seems like it was just yesterday in a lot of ways.
I love you sharing that story, and I have to admit, I'd be the same way, looking around going, who are these people that are doing this for us? And I want to know who they are, and I'd want to meet them as soon as possible. I totally get that. To those watching, if you have any questions, use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is there on your screen. Jeff, we saw that you're back to hunting. How often do you get out there?
Being retired, I tried to get out. I love the woods. I spent a lot of time growing up. I've learned a lot of good things from the woods that carried through my life. My grandson now is taking a liking to it also, so it makes it real special hunting for 3 generations.
Okay, those turkeys, what are you doing with those turkeys? Are those Thanksgiving turkeys? Those are pretty magnificent.
Come to our house. They're all mounted, hanging in down in the
They go into a special place, and I can tell you a memory of everything down there.
I bet. I love that. Love seeing those photos with you and your boys. Has the transplant changed anything about your diet? What are you doing differently?
I made Jeff a promise before I left, whom I'd take excellent care of his liver. And to this day, I think I've held up pretty well with it. We did change our way of eating. I did, and my wife, we did it together. We eat a lot of fruits, vegetables, chicken, fish, stuff where before I was always a meat and a potato guy. I learned to adapt real well to it. And I can remember this. I'll share this story real quick. Last time I seen Dr. Humar, my weight was the same as I graduated from high school. It was 235 pounds, and I saw Dr. Humar, and he said, I think your weight's a little high. And I said, well, that's what I was when I graduated. I feel healthy and strong at this weight. He said, well, I'd like to see it down around 215 or 220. And I kind of chuckled a little bit, and I said to him, well, the guy that saved my life, I guess I can lose a few pounds. And he kind of chuckled. And
yeah.
I held up for that also. So I'm down to where he wants me in weight. I try to stay active. That's the key. Keep moving.
Good for you. Good for you. It's hard to make those life changes, but definitely worth it.
Yeah.
Do you have to stay on any medications?
Yeah, I'll be on medications the rest of my life. I take 4 pills in the morning and 2 in the evening. And it's, I have an alarm. Me and my wife both set alarms on our phones because it's kind of crucial that you take them 12 hours apart. So I'm set on a 9 in the morning and a 9 in the evening. And we do very well together. I'm very happy with the way I've been able to take my medicine. And if I forget, she reminds me. And it's a
well, and our grandkids help too.
Yeah.
His alarm's actually a duck quack. And the kids can be anywhere in the yard or in the house, and if they hear that duck quack and they come hauling past, it's time for your medicine.
I love that.
Yeah, I have a lot of helpers.
It's a team effort for sure.
Yeah.
I think that's great. Jeff, you said this is the biggest accomplishment of your life. How do you talk to other people about this? I'm sure you get a lot of questions. What questions do you get? And how do you talk to people about the idea of becoming a living liver donor?
Yeah, well, for starters, early on, I just kind of talked to friends and people close to me and didn't, talk more broadly than that. It felt like it was selfish to tell your own story like that. But then one day I realized that if I talked about it in settings like this, that it might encourage someone else to do it. And then I kind of got a different view of it. When I talk to people, a lot of times people were like me when I first clicked on that ad, that you didn't know you could do this, and you didn't know that the liver regenerates. So there's a lot of people that are like, I didn't know that. And so I think there is a lot of education that can be done to bring more people into this process.
I love that part of the story. You're supposed to like click away from those ads as quickly as possible. Aren't you guys glad that he did not deny those pop-up ads? So I want to ask docs, what's the biggest questions that you get, or the barriers for people becoming a living donor? Anyone want to jump in?
I think most people just don't even know about it, which Jeff is right. This is one way to educate the population that you can give half of a liver, or one of your kidneys, and help not just one people, but a whole family. I mean, look at his family. I mean, he's got his grandkids, he's hunting. You know, he's probably now rooting for Ohio State. He's got part of Ohio State in his organ.
Right?
I mean, it can change people's lives, and I think if people knew that they could do that, it might help. Fear and education are some of the most important things we can do to help people understand.
Dr. Coomer, same question. Just what if someone were to ask you in passing, you know, about this and the safety behind it and any concerns they might have, what would you share with them?
I think people just really have to get educated about it. You know, just knowing something about it. I mean, a lot of people don't know about it, and then they don't know where to go to talk to someone. You don't go to every hospital. Every hospital doesn't have that. You have to go to a transplant center, and not every transplant center has a living donation program. So it's about overcoming those fears. It's about access, about getting people in and getting educated about the process. Because some people come in and get educated and they say, no, this is not for me. And others said, I'm all in. And so education is the first step.
Dr. Taylor, what's the leading cause, some of the leading causes for needing a liver?
The two top causes right now are fatty liver disease and alcohol. So that's what we see. Most of our patients that need a transplant are related to those diseases. Used to be viral hepatitis C, but that has had great medication cures, and so we're seeing that disease actually go down. And so that's been a great breakthrough, but other diseases have come and taken the place. So the need for transplant has not decreased at all. In fact, it's gone up.
Docs, what's it like to see this story play itself out and to see Jeff doing well and Jeff doing well? What's that like?
I mean, it's fantastic because we spend a lot of time grinding, doing work, and every once in a while we forget what we actually do, and this is a nice reminder that we actually can help people when people are giving their organs, and we can facilitate this kind of stuff.
Yeah, because how it works is Dr. Taylor sees them on the beginning, on the front end, and at the other end, and then Dr. Coomer takes it out, you put it in, and then sometimes you don't see the end result.
We just are focused on our task, and we don't get to see the social impact, what it can have for their family and their lives.
Very cool. So if someone's interested in doing something like this, it's such a big deal, but if they're watching and they're like, I just want to learn more, I want to find out if I could qualify to give part of my liver, what do they do? Who do they call? Where do they go?
They can call the transplant center. I don't know if we have the phone number available, but then they can talk to our living donor team, and they can see if they can, get screened, get evaluated, get education, and that would be the start.
It's just the start, yeah. There's no one's holding your feet to the fire.
No.
It's just call, find out, and then you'll take it from there,
Yep.
and just see how far it goes. Let's get to some questions from our community if we can, because Angie wants to know, what are the risks? Are there risks for people like Jeff donating? Any complications possibly?
Yeah, there are risks to donating your liver. I mean, it's all about the evaluation. You don't want to operate on somebody who's otherwise perfectly healthy, but there are risks of bleeding, hernia, and in the past, the complications of even liver failure and needing a transplant themselves, but that's decreased over time as the technology gets better.
Alexis wants to know, how is the liver able to regenerate itself?
It actually doesn't regenerate a new right lobe. It actually the left lobe just gets bigger. So the liver it's all related to blood flow. So if you cut out half the blood flow and then the other half gets more than all the blood flow, then it just generates and regenerates, it gets bigger.
Marsha wants to know, what causes fatty liver? How can we avoid this? Is there anything that we can do to prevent fatty liver?
So fatty liver is the #1 cause of liver disease now in the United States. It has to do with our lifestyle, with our dietary choices, our activity levels, and then some genetics thrown in the mix there. But the American lifestyle of too much good food and not enough exercise just contributes to all of that, and the liver just can't keep up with clearing the extra calories and nutrition that are hanging around.
So you're saying that we do have some control. There are some things that we can do to keep ourselves out of that space. Vera wants to know, is there an age restriction for donors? And does a cancer diagnosis of any kind rule you out as a donor?
The usual living donor is like 55 to 50, and it depends on what kind of cancer and how long ago it was, which really determine that question.
Jill wants to know, Jeff, if you have any restrictions to your diet or any activities, or is it just all systems a go?
No, it's I'm completely back to the way I was before, and that was really pretty quick after the surgery. I was back to that. It was just letting the incision heal and letting that new organ grow, and I was back to normal.
Love it. Vera has another question. Back to the hepatitis C comment. Can a former hepatitis C patient who was cured, can they donate?
I would leave that one to Ryan on that.
Yeah, they sure can, but they would just have to have not a lot of damage to their existing liver. So if the hepatitis C has already caused that patient some problems to their liver, that could be a problem.
All right, I want to get to our takeaways today. So I want to start in Pennsylvania with Jeff and Susan. Jeff and Susan, first of all, just thank you for being with us. We're so glad you're all doing well. Thank you for sharing your story. What do you really want folks who are listening and watching to take away from your story?
Well, I'd like to, people to realize that changes people's lives tremendously. It gives me a second chance at life, changes the way you look at your lifestyle now. And it's just a God-given blessing.
It takes special people like Jeff Reisinger, and he's talked about in this house more than he could ever imagine because of what he did and his selflessness. That's what it takes. Our family, I think we're all organ donors on our license, but honestly, none of us, you always think of that as when you're deceased, you can donate. None of us were really familiar with and aware that you could do a living donor either. So people like Jeff Reisinger truly changed people's lives.
Thank you both for sharing today. Be well. Jeff, what's it like to know that your name is swirling around the whole household and they talk about you all the time, and you really have just set in motion a whole new life for these folks?
Well, that's the premise of one of your earlier questions was why would you donate to a stranger? Well, what you see today is they're my family now.
Yeah.
It's not a stranger. At the moment of that decision, maybe I didn't know them, but I know them really well now. And when you get to know folks like the Hulls, you realize that what you get in your heart and soul from this process is far more than you give. And I would just encourage anybody that's in a position to think about this to realize that.
Thank you for sharing your story, and thank you for your gift. Thank you for your gift. Dr. Taylor, what's the big takeaway today?
I think it's important to have conversations with your family, friends, and always have a listening ear and be aware if someone's in need or you hear about someone that could have this, and reaching out to a transplant program if you're interested in being a donor is always welcome.
Dr. Schmidt, what's the big takeaway for those watching?
I think it's just great to see that people that care, give, donate, and we just need more people to know that you can do it, and then if they see the effects, it's hard to deny why he did it after seeing what had happened to their family.
Yeah, watching the story, it's a huge impact, huge impact. Dr. Coomer, wrap us up. What's the big takeaway?
Well, I think, we always talk about transplant. It's the everyday miracle, and it's pretty incredible. I know that we kind of take it for granted sometimes when we see an organ perk up and start making urinally a kidney or making bile in a liver, but it's pretty amazing. It is a miracle, but it happens every day, and it can't happen without donors, and whether deceased donors and living donors. Donors are the hero of all this, and donation, whether it's living or deceased, is what keeps humanity alive. I mean, it's just an incredible gift. So that's my last my last words.
You did good, did good. Docs, thanks for all the work that you do. Thanks to all of our amazing guests today and to our viewers for your great questions. Have a great day, and we'll see you back here tomorrow. Underserved and at higher risk, Latinos are both when it comes to infectious diseases and recognizing dementia. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Details of new programs and tools designed specifically for this population. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.